Hi, everyone, and welcome again to another segment of ACRP TV. My name is Michael Causey. I'm the editor-in-chief here. Today, our spotlight is on how to get your work site up and running after COVID-19. And I say after loosely, of course, it's still with us, going to be with us for a while in some form or another. Hopefully, we're mitigating it. Things are looking a little more promising, certainly in some parts of the country, more quickly than others. But here to help us kind of wade through it is Karina Loyo, who's the Director of Clinical Research Services at Prelude Dynamics. Karina, thank you so much for joining us today.
Oh, you're welcome. Thank you for letting me come on board and talk to everybody about it.
Now, we're in a fluid situation. You and I are speaking in early June 2020, and we're starting to have phase one improvements of, people are starting to sort of get back to normal in some situations. People are starting to go back to sites a little bit, patients returning. So talk to me about how you're advising people in your own experience, how you're able to kind of roll up your sleeves and get back engaging with patients again in the way you were a few months ago.
Okay, so first I just want to give a little bit of background on my knowledge and where it comes from,
Sure.
so that everybody knows where I'm coming from and where the information is from. So I have a doctorate in health education, which is a part of public health. I work as a volunteer with the Medical Emergency Response Corps of Williamson County. And so I help them with their call center and answering some of those questions. So I do that in addition to my job as the Director of Clinical Research Services for an EDC provider called Prelude Dynamics. And so one of the big things that we see during this time is the question of how do we get back to work? How do we get to the point in which we can see patients if we need to see patients? And even how do you react in situations in which you might have had an exposure to COVID within your facility? And so there's a lot of things to really think about when going back. For example, to begin with, most of us, all of us should have a business continuity plan, but I bet none of us had a pandemic in there at all.
Right.
We had things like hurricanes and tornadoes, power outages, but nobody ever thought of having a pandemic. Now, years ago, when I worked at the state of Texas and also at the city of Austin public health departments, we were having those conversations. So we're talking 10, 15, 20 years ago, we're having the conversations of what do we do when this pandemic hits? It was never a matter of if it was going to hit, it was a matter of when it was going to hit. And so here we are today in COVID. And so I bring with me some of that knowledge to share of what we were talking about back then, as well as the stuff that's available right now. Some of the things that I do want to point you to, if you're thinking about reopening your work site, I know the type of work site you have may vary, but the guidelines that are available to you, they're pretty standard. Right? I mean, we've all heard it. People should wear a mask. It protects others more than it protects you. But still, it protects people and helps slow down that spread of disease. And that's what this is all about. We've also seen proper use of hygiene, washing your hands on a regular basis. Those are all the things that we've heard constantly in the media. And so definitely the first source of information, the Centers for Disease Control. And I believe y'all are going to put the link to the Centers for Disease Control there. And then the other source that I think is really good for work sites is the American Industrial Hygiene Association. So they have a really good detailed list of information that you can use related to that. And so I think the main two things that are very important during the reopening of the work site are going to be to make sure that you're following the guidelines that have been set forth through the main source, which would be the CDC. And then the second part of it is communication. Communication is going to be absolutely critical. And what is really neat about this is it offers an opportunity not only to help with this whole public health pandemic thing, but also as a business to reinforce to your employees that you care about them, and to anybody that you're working with, whether it's a subject participating in one of your studies or whether it's one of your clients coming into your clinic, to be able to tell them that you really do care about their health and well-being and that you're willing to go over and above and do your part. And so I do think it provides us that as a really great opportunity. And I know what business doesn't have the opportunity to improve their communication either to internal stakeholders or external stakeholders. And so I think the way that you approach this whole reopening is really going to help improve the image of your business overall.
Interesting. Let me ask you, this is a kind of a broad question, but from your anecdotal experience and your own location and where you're operating, what's, trying to think of the best way to ask this, what's the mood out there, do you think? I mean, are people scared to go back to work?
I think you have two types of people. You have the people that are scared because they realize we still don't know everything that we need to know, and there have been a lot of deaths. And then also one of the things we don't hear or talk a lot about is the disabilities that are happening related to COVID. Because, anybody who's had pneumonia knows that it can take 3 or even 6 months before they're even breathing and back to normal. And we do know that COVID does cause some lesions in the lungs, which may or may not be able to heal. Because again, we don't know enough about this, right? And so hopefully, as we learn more, we'll be able to be more prepared. But that does cause some people to be very concerned. And then there's also the people who are at highest risk, right? I mean, you have some older workers who may have comorbidities like diabetes or heart disease that may cause them to also be at greater risk. So they're probably going to be more concerned about going back to work and being in a closed environment with other folks. And a lot of what you see in the recommendations is things about improving the airflow, maybe even letting natural air from the outside come in, which is fine unless you're in Texas and it's 100 degrees, which is where I'm at. So it's okay right now, we're probably about 80 or 90, but in a month or two, we'll be at 100. So that's not going to be possible. And so it is important for people to really think through the process. And one of the phone calls, for example, that I got when I was working through the volunteer Medical Emergency Reserve Corps was related to a physician wanting to know, well, what do I need to do in order to be able to prepare for if I do find out that somebody is positive, either a patient who came in to work with one of my, say, physical therapists or occupational therapists, or whether there was one of the therapists themselves who got sick. What action do I need to take? Do I need to shut down? Do I need to call everybody? What is it that I need to do? And I can tell you from a public health point of view, one of the most important tools that we have at our disposition is something called contact tracing. And contact tracing is the idea of finding out who that infected person has been in contact with. Typically, we're looking at 2 to 3 days before the onset of symptoms, and then all the way through until they realize that they were sick and they got testing and know that they're positive. So that can be a 2-week time span for some people. And then this is even complicated by the fact that some people are asymptomatic. So they may not feel that symptom until they're further down the line. And so knowing who you've been in contact, who has come to your facility, keeping track of that is going to be very important. And we see things like the nursing homes or assisted living communities are doing an amazing job at that. So some of the things that they're doing is they have forms that each person who comes in to visit an older person fills out. So basically a visitor log where they're tracking who's come into the facility. And I know a lot of the physicians' offices or even some of our sites that we do research with, that they can pull up, who's come in based on their schedule. And they can see the patients that have come in. What they probably don't have on there, which is important, is what vendors they may come in. Because we know that sometimes some of our nursing homes have infections originated with people who are dropping off inventory like food supplies or things like that. And so it's important to really track everybody so that you're able to help give the information necessary to do this contact tracing. Because the idea behind contact tracing is we find out everybody who's been exposed, we ask them to isolate, and then we don't need to go on another lockdown like we did for the last 3 months, right? Or 2 months actually.
Feels like 5, but yeah.
It feels like forever, yes.
Crazy. Well, we've been speaking here with Karina Loyo. She's the Director of Clinical Research Services with Prelude Dynamics, deep in the heart of Texas. Karina, I want to thank you so much for your help here on our ACRP TV spotlight on how to get your site up and running after COVID. You've given us some great ideas, and we are going to include after this a title card showing some of the links that you provided to us,
Okay.
EDC and others. So I want to thank you so much for your help, and we're all in this together, and we're gonna muddle through and emerge stronger on the other side. Thank you so much, Karina.
Thank you.